Hello everyone, welcome back. My name is Dr. Vijay Bhatia. I am a psychiatrist and work in the mental health. Today we are going to discuss about negative symptoms of schizophrenia and other symptoms in schizophrenia. What are the negative symptoms of schizophrenia? Number one, alogia. What does alogia means? It is a dysfunction of communication. So the person is having problems with communication, restriction in the fluency and productivity of thought and speech. Number two, affective blunting or flattening. That means restrictions in the range and intensity of emotional expression. Asociality, reduced social drive and interaction. Anhedonia, reduced ability to experience pleasure. Avolition, reduced desire, reduced motivation or persistence, restrictions in the initiation of goal-directed behavior. So they all start with A. Alogia, affective blunting or flattening, asociality, anhedonia, and avolition. Blunted affect, emotional withdrawal, poor rapport. If you try to develop a rapport with them, some kind of trusting relationship, it is very difficult. If they visit any party or any happy moment, their mood is very blunted. They don't express great feelings, either feelings of excitement or sadness, and they are emotionally withdrawn. They show passivity, as if they are like walking like a robot, like if somebody external forces are controlling their emotions and feelings and even movements. Apathetic, social withdrawal. They don't want to interact with other people. They would sit alone, like their own company. Difficult in abstract thinking. So if you make a joke, they might take it seriously because they don't have that abstract thinking. They believe more in concrete thinking and make the concrete reasoning rather than abstract thinking. There is lack of spontaneity even in their speech. They will answer the question only what is asked. They will not spontaneously talk about things that they are interested in. They have certain type of stereotyped thinking. They're occupied by certain ideas in their mind, some kind of imagination or some kind of thoughts that are preoccupying them, and they keep on thinking on certain same theme. Even if you want to change the subject, make a laugh or joke, they are not interested. Alogia, restriction in fluency and productivity of thought and speech. Because there is restriction, the number of thoughts coming to their mind, they are only few thoughts and they're preoccupied by that. Therefore, not much in their speech. And avolition, restriction in goal-directed behavior. So if they have to achieve something, to do certain things, there is restriction. Anhedonia, that means lack of pleasure, and there is some form of attentional impairment. They cannot focus for too long on certain things, and even within if the program is going on, they will be focused on only one or two things, and other things are being ignored or not paying attention. When we say alogia, that we said it is a dysfunction of communication, the examples will be they will talk little and use only few words. Dysfunction of affect is affective blunting. That means there is a reduced range of emotions. If they see something nice, they will not express feelings. If they experience something, they will not have very much emotional attachment to it or expression. They feel as if they're numb, they're empty inside. There is nothing to talk about or have fun about or joy about. Recalls only few emotional experiences. Either they are good or bad, they will recall only few. Dysfunction of socialization is called asociality. That means they have reduced social drive and interaction. They do not find social interaction as interesting even with their close friends. They don't have many friends. They have little sexual interest. They have very few friends and little interest in spending time with or little time spent with their friends. Dysfunction of capacity for pleasure, that is anhedonia. Reduced ability to experience pleasure, find previous hobbies or interests as unpleasurable, as if they are not giving the same kind of pleasure they used to get. Dysfunction of motivation, avolition, reduced desire, motivation, reduced ability to undertake and complete everyday tasks, may have poor personal hygiene. Their bedroom will be untidy, their clothes may be untidy, not cleaned or ironed. Sorry. Negative symptoms can also be present as prodrome. This is important. Negative symptoms are not just part of the syndrome schizophrenia, they can also be part of a prodrome that begins with subsyndromal symptoms that do not meet the diagnosis criteria of schizophrenia and occur before the onset of the full syndrome of schizophrenia. Prodromal negative symptoms are important to detect and monitor over time in high-risk patients so that the treatment can be initiated at the first sign of psychosis. Negative symptoms can also persist between psychotic episodes once schizophrenia has begun and reduce social and occupational functioning in the absence of positive symptoms. So what happens? This is actual schizophrenia where the overt signs, delusions, hallucinations are present. However, in high risk, what do we mean by high risk? High risk patients are those where there is a very strong family history of schizophrenia. Either the mother or the father suffered from schizophrenia. They are high risk group of patients. So what happens is they develop some kind of prodrome before the actual onset of the schizophrenia. They have these features which are mostly negative. They can be part of the negative symptoms with the affective blunting and flattening, anhedonia, loss of pleasure and stuff like that. They can be present in these patients for some time before the actual diagnosis of schizophrenia is diagnosed. And also between episodes of schizophrenia, there will be periods when there is this negative symptoms of schizophrenia may be present and dominating in their part. So it's important to recognize and treat this, although the medical medications are less effective in this, but psychosocial interventions from the psychologist and therapist can help quite a big deal. Now, apart from the negative symptoms of schizophrenia, there are cognitive symptoms of schizophrenia. So, what do we mean by cognitive symptoms? There will be problems representing and maintaining goals, problems allocating attentional resources, problems focusing attentional resources, problems focusing attention, problems sustaining attention, like concentration will be poor. Problems, they have problems in maintaining it. focusing and sustaining, problems evaluating functions, problems monitoring performance, their own performance. They have problem in monitoring that. They will have problems in prioritizing. If you give a list of items to them and tell them, can you prioritize these events, they will have difficulty. Problems modulating behavior based upon social cues. So if somebody is giving them a cue, and they will have problem in understanding those cues, social cues, and they will have problems in modulating their behavior. Problems with serial learning. If you ask them to do serial learning, like count 7 and keep on adding 7 or subtracting 7, they will have difficulty. Or one event after the other, they will have difficulty in remembering those things. Impaired verbal fluency. If you ask them to say the words beginning with letter F, count 10 or something, they will have problems with that. They will have difficulty with problem solving. If you give simple problems and ask them to solve like puzzles, they will have difficulty. Other disorders where cognitive symptoms are also present. So we mentioned that cognitive symptoms are present in schizophrenia, but these cognitive symptoms, they can be present in number of other psychiatric disorders or mental health disorders. Number one is autism. Autism is a psychiatric disorder where there is problem with socialization, with communication, interaction with other people, understanding the cues in the social interactions, and they will have their own magical type of thinking. Post-stroke dementia. So any kind of dementia, they will have cognitive problems. We are talking about attention, concentration, orientation, short-term memory, long-term memory, verbal fluency, abstract thinking. These are the cognitive functions, and all the dementias, either due to the vascular dementia is after a single stroke, there is either bleeding or blockage of the vessel supplying to the part of the brain, and as a consequence of that, they develop memory problems and other cognitive deficits. Or it could be multi-infarct dementia, meaning they have developed over a period very little small infarcts in different parts of the brain, and over a period of time, so they will have these cognitive deficits. Alzheimer's disease is a typical disease for causing, or the commonest disease causing the dementias, and even other organic dementias such as Parkinson's dementia, Lewy body dementia. They are quite similar, Parkinson's and Lewy body, where the motor movements are affected. In Parkinsonian, patients may be suffering from Parkinson's disease for a long time, then they develop the cognitive impairment and called dementia and Parkinson's disease. They can be in a frontotemporal dementia, or also called Pick's disease, where there is lack of frontal control of the brain. Patient can be very impulsive. They might develop problems with the bladder control or impulse control, or understand the behaviors. Other symptoms in schizophrenia, although we looked at these before, they can be affective symptoms, but these symptoms, like mood symptoms, can also be present in other disorders. They are not typical of schizophrenia. So like depressed mood, anxious mood, guilt, tension, irritability, and worry are frequently accompany the schizophrenia. However, they are not only part of this, they can be part of number of other mental disorders. These are also present in major depressive disorder, psychotic depression, bipolar disorder. Bipolar disorder is the one where mood swings very high for a period of time, for a couple of months, then they have depression. So it alternates, and there might be periods in between where they are normal. Schizoaffective, both the schizophrenic symptoms and mood symptoms are present together or within a short period. Or organic dementias, as we talked about, vascular dementias, childhood psychotic symptom disorders, all these mood symptoms, guilt, anxiety can be present on all these, and treatment-resistant cases of depression, bipolar disorder, schizophrenia, and among others. Aggressive and hostile symptoms. We discussed them more in the positive symptoms of schizophrenia, and these are common in schizophrenia, but these symptoms can also be found in a number of other mental health disorders, especially the impulse control problems. They are also present in other disorders, especially those problems of impulse control. Symptoms include overt hostility, such as verbal or physical abusiveness or even assaults, self-injurious behavior, and including suicide, arson, setting fire, or other property damage, damaging cars or damaging furniture or damaging the walls, doors, and sometimes even sexual acting out, doing sexual acts which are inappropriate for the time and place. These same symptoms are frequently associated with a number of other mental health disorders, including bipolar disorder, especially when they are in their hypomanic or manic phase, childhood psychosis, and also in borderline personality disorder, where they can have brief periods of psychosis, where they have present with aggressive and hostile symptoms. These can also be present in drug abuse, people using cannabis, cocaine, LSD. They can present with aggressive and hostile symptoms. And even dementias like Alzheimer's disease and other dementias, they can present symptoms with aggression and hostile. Attention deficit hyperactivity disorders, ADHD, conduct disorders, and many other disorders. So what we are trying to say here is that these symptoms, both affective symptoms, aggressive symptoms, hostile symptoms, they are not unique to schizophrenia. They can be present in a number of other disorders of the mind. If you like this video, please press the like button, share with your friends, and subscribe this channel. There are other videos separate on positive symptoms of schizophrenia and other mental disorders. I'll see you again in my other videos.